Hi, today we're going to be talking about helping graduate nursing students analyze healthcare websites for readability and appropriateness. And this is part of the Society of Teaching and Learning in Higher Education Conference 2021. My name is Tracy George, and I'm an associate professor at Francis Marion University in Florence, South Carolina.
Hi, my name is Claire de Cristofaro, and I'm a clinical assistant professor at the Medical University of South Carolina.
There are a couple of objectives for this presentation. First, we're going to define health literacy. We're going to talk about digital health literacy, also known as e-health, and we're going to talk about the incorporation of digital health literacy into the curriculum for a healthcare program through a learning activity focused on the analysis of healthcare websites.
Well, I'm going to talk a little bit about the background about health literacy and its impact on healthcare. And first of all, we can define it, and it's the degree to which an individual has the capacity to obtain, communicate, process, and understand basic health information and services. And this will allow them to make appropriate health decisions as a partner in their care. So the idea is that a health literate patient would be able to realize their optimal potential in health situations. And also these skills could also be applied by healthcare providers and other healthcare personnel to provide health information and services to others. Now, one of the issues is low health literacy, and we do see this in the USA. Nearly 50% of Americans have issues with low health literacy, which can lead to negative health outcomes. When we also think about the populations of patients, the subpopulation of older adults actually often comes up because they are one of the higher utilizers of healthcare services. And they also have caregivers who may also be making healthcare decisions on their behalf. Studies have shown that actually increasing health literacy can reduce elder abuse, because a lot of elder abuse is arising not from maliciousness, but from economic need, lack of education, or some other societal need. Now, when we think about healthcare professionals and health literacy, as I mentioned before, we want the patient to be a partner in their care. They should be having an active engagement to manage their own healthcare decisions, and this will actually support optimal outcomes. So one of the things is that we should think about all the variety of healthcare professionals who also need to have skills in health literacy. And they can also employ this not only in their daily provision of services, but part of their patient education. And it will help their patient make decisions, align decisions with patient preferences, and also assist in finding available health services. Now, when we think about health literacy in today's world, of course, what comes to mind is, as I always say, can I do it on the internet? And so digital health literacy, or e-health with a little e in front of it, like we've seen on so many things, would be looking from electronic sources in order to gain and apply knowledge. So we think about health information technology, or HIT, which involves the use of electronic devices and systems. And as you know, these are integral to healthcare globally now. So with our focus on education, we wanted to make sure that students also are knowledgeable and skilled in the informatics aspect. So when we think about patients using the internet, there have been some resistance to the idea of having a focus on health literacy in curriculum, thinking that patients really are not using the internet, they are not interested in that. And this resistance actually is a false concept. 8 million Americans use the internet daily to research health-related topics. Patients with chronic diseases actually are more likely to use information from websites. One of the problems, of course, is that there are many, many unreliable websites providing incorrect information. We have websites, of course, that are trying to sell the individual something, or they have a specific agenda that may not be valid in terms of evidence-based practice. And so being able to analyze a website for reliability, for validity, is extremely crucial. Another concern when people are using electronic sources is the readability of the site. Some consumer patient education sites have a very high readability index, such as the 10th grade or higher, and that exceeds the recommended 6th grade reading level. The idea is that you would want to have your site utilize language and verbiage that would be accessible to the average reader. So therefore, we come up with the idea of a digital divide. We see that people with low health literacy may actually hesitate to use the internet for the reasons I just mentioned. In the past, it was more a disparity in access, having broadband or having a hardware such as a computer or a tablet or a smartphone. But now the issues in terms of the digital divide tend to be related to needed skills and how to search for information, how to use information. So therefore, when we think about it as educators, we want to think about how to incorporate learning for our students that will allow them to have the availability of toolkits for themselves and their patients, and also learning activities for different disciplines and different levels of learning. So when we're teaching digital health literacy, we do know from many studies that our students, healthcare students, routinely are going to use the internet looking for information. As little as a decade ago, people were turning to books. And I remember the days, having been in education and healthcare for many, many decades, where we literally were dragging in many books in a backpack every time you went to the clinic, not knowing what would be there in terms of the availability of reference materials. We were donating books to hospital libraries so that we'd be able to go ahead and have a resource there available. Now, of course, with the availability of the internet, people are turning there first. So therefore, it is essential that we're competent in using this technology. How do you perform an internet search? Can you use word processing software? And so the idea is that information literacy is an aspect of digital health literacy. So we do need to educate our students about digital resources and how they can be used not only for their own learning, but to support patient education. How do we use a search engine? How do we utilize patient portals? Many, if not most, healthcare providers now have at least an option for a patient portal where they can do something as simple as make an appointment or actually email their healthcare provider, check lab results. And also they're popping up as self-check-in kiosks. So there's less face-to-face communication with individuals in real life, or IRL, as the youngsters say. And also, of course, with the pandemic that we've experienced over the past year, we have also seen that transactional distance increase because there has been less face-to-face interaction in person. So we need to recognize that these resources have value. We need to have patients understand that they may need to have agreements that agree to texting or email reminders, and also possibly how to use mobile applications. Telehealth, for instance, is going to possibly require them to download an app or a software program that will allow them to have a telehealth experience. So when we thought about curriculum integration for healthcare students, and we wanted to also look ahead to the goals of Healthy People 2030, which states that digital health literacy does need to be part of the curriculum for healthcare programs, we realized as educators that we have to create student learning activities that will help promote the awareness and competence in digital health literacy. So some of the goals of curricular initiatives could be, if you're thinking of learning activities, the goals could be supporting patient education proficiency. So can you help a patient read, understand, and apply health-related information? Or how can you find and evaluate resources? And so that would include both traditional resources as well as digital resources in terms of creating learning activities for your students. Now, therefore, when we think about curricular initiatives, we thought about some key points: the ability to identify patients with low literacy. How can you tell that your patient actually has low health literacy? It could be that actually poor compliance with treatments or missing appointments, confusing medications, making excuses for not looking at education materials. It could actually be a literacy issue that the patient is hiding or even not aware of. Can you communicate using plain language, avoiding clinical lingo, giving short and understandable explanations for both the diagnosis or treatment options and expected outcomes, and key messages that can be distilled into understandable information that focus on what the patient needs to do to be a partner in their care to achieve their desired outcomes? One method is the teach back method, which you can check the AHRQ website. This allows a person to check for understanding, uses open-ended questions, and reteaching if needed, if you find that the patient does not have the necessary level of understanding, after you have recommended a clinical intervention or after you have prescribed a drug or other clinical therapeutic. So when we think about patients going to find resources, or you are recommending resources for a patient, as I mentioned before, readability becomes very important. So the National Institutes of Health in the USA recommends that health materials should be written at no more than the 6th to 7th grade level. And you actually can test a site or any other resource for readability. There are several scoring tools that can help support patient-centered care.
Now I'm going to talk a little bit about a learning activity where I had the students to evaluate web resources for readability. And as Claire mentioned, patient education information should be no higher than 6th to 7th grade reading level, but research shows that reading materials are often at the 10th grade reading level or higher. So many of the patient education materials that you may recommend may be above that recommended reading level. And I live in a rural area of South Carolina, and in our area, many of our patients read at the 4th to 6th grade reading level, which demonstrates the need for additional support regarding digital health literacy. So I teach a graduate patient education and advocacy course for nurse practitioner students. In this course, I had the students to analyze national healthcare websites for readability, design, layout, cultural sensitivity, and the appropriateness for our rural low health literacy population. And the students used a validated scoring tool to determine the readability, the Flesch-Kincaid formula. And the Flesch grade level readability formula is based upon the Flesch Reading Ease readability formula. And it's kind of interesting. It was developed by the US Navy and has been used by the US Department of Defense. And a score of 9.3 would mean that a 9th grader would be able to read the document. And Microsoft Word can actually display information about the reading level of a document using this formula. You also can cut and paste information from the internet into a Word document and determine the reading level using this formula. This is just the way to do it manually if you wanted to do this formula manually. So students in this course self-selected one website for analysis from a list that I created. Some of the web pages that they could choose from included Wikipedia, Mayo Clinic, WebMD, MedicineNet, and the National Institutes of Health Topics. And these are common patient education sites in the United States, and that's why I chose them. So the grading rubric, I had the students to tell me, for what reasons did you choose your web page for analysis? I had them to discuss the content of the web page. Did it include cultural and ethnic sensitivity in images or wording? I also asked them to discuss the layout and the use of white space in images. Also in the US, there's the 2003 National Assessment of Adult Literacy. So they were directed to go to that website and determine what percentage of people lack basic prose literacy skills in Dillon County, South Carolina, in the state of South Carolina, as well as the United States. I also have them discuss the meaning of the term lacking basic prose literacy and provide examples from their website. So those were some of the grading rubric components. I also had them to determine the readability of the web page based on the Flesch-Kincaid formula. They had to determine if it met the goal of 5th grade or less, and if not, what would they modify to actually achieve that goal. I also asked them for their personal and professional reaction to the readability of the web page that they analyzed, and would this reading level be a barrier for low literacy patients? I also asked them to discuss their perspective on the importance of educating patients to identify, to use reliable and accurate internet sites in patient education. As we know, many patients come in and they may be researching their health topic on a very unreliable website. They also had to include 2 references and they had to use appropriate APA format and grammar. So what the students found was that the internet sites were written at a high reading level. And in fact, the reading level varied from the 7th grade to the college level. So they did not meet the recommended goal. And many sites were around the 10th to 11th grade reading level. And if you think about the rural population that we serve here in South Carolina, that's at the 4th to 6th grade reading level, that's certainly way above their ability to comprehend that information. Students provided some spontaneous feedback, and some of the comments included, I was surprised at the high level of readability of the web page I analyzed. Another comment was that the readability of this web page would be a barrier for low literacy patients. A third comment was healthcare providers must promote the use of reliable websites. And the students in this course felt that they obtained an increased awareness of the issues of readability, as well as the appropriateness of information on national healthcare websites. They also felt better prepared to educate patients about the issue of digital health literacy after participating in this learning activity. So this project was completed, and we did actually some follow-up research. Because it was so enlightening to the graduate nursing students, and they felt that it was valuable. So an additional data-driven study was completed this past fall in 2020 that evaluated the graduate nursing students' digital health literacy and their perceptions of the role of digital resources in patient education prior to and after they analyzed healthcare websites for digital health literacy. And we actually have an article in press in the Journal for Nurse Practitioners, and we do have an additional author who provided some statistical expertise. And the scoring tool that we used in the data-driven article was the eHealth, the eHealth Literacy Scale. So in conclusion, the impact of low health literacy on patient outcomes is huge. And patient education is a very important part of health literacy, and healthcare students need to have the necessary tools to assess and support health literacy in patients. Digital resources, as we know, are becoming the standard primary source of information, so digital health literacy is crucial. And initiatives in the curriculum should support the knowledge and skills in digital health literacy in order to improve communication, facilitate safe patient care, as well as support quality outcomes and efficiency. If you have any questions, I've included both of our emails. Please feel free to reach out to us. And our references are on the following 2 slides. Thank you so much for attending our session today.
Thank you. Enjoy the rest of the conference.